Pyriform fossa or mucus-lined depressions which are found on either side of the laryngeal inlet. This is how we define it. Location, as I just mentioned, on either side of the laryngeal inlet. What is the important relation and what are the boundaries? The Pyriform fossa is bounded medially by the aryepiglottic fold, and aryepiglottic fold, as we know, forms one of the important boundary of the laryngeal inlet. Laterally, it is found by the mucous membrane which lines the inner surface of the lamina of the thyroid cartilage. Above, there is a fold called as pharyngoepiglottic fold which limits this from the epiglottis. So, this mucus-lined depression contains the internal laryngeal nerve which pierces its lateral wall by passing through the thyroid membrane. Along with the internal laryngeal nerve, we also have the superior laryngeal vessels. This is one important relation of pyriform fossa we must remember. What is the function of pyriform fossa? Pyriform fossa in lower animals act as lateral food channels, especially in case of ruminating animals like cows. The pyriform fossa acts as a lateral food channel. These ruminating animals will keep the food here in the pyriform fossa, again bring it back to chewing, then again send it back to the digestive tract, right? So, this is the function of pyriform fossa in ruminating animals. Whereas, in case of human beings, this acts as a catch point for foreign bodies. The chicken bones and the fish thorns usually get stuck here, and also occasionally the foreign bodies which are swallowed by children are lodged here in the pyriform fossa. So, it basically acts as a catch point. Then, the third important function, or not exactly a function, the pyriform fossa was occasionally artificially deepened by smugglers to hide precious material. So, hence it was also called as smuggler's fossa. So, sometimes this can be asked in your Viva. Examiners who want to check other understanding of anatomy, they might usually interrogate with you such questions. What fossa is called as smuggler's fossa and why is it called so? These are the three important functions. Then, what is the clinical importance associated with pyriform fossa? Remember, an attempted removal of foreign bodies which are stuck in the pyriform fossa can result in injury to internal laryngeal nerve. So what? Remember, internal laryngeal nerve is the chief sensory nerve to the larynx above the level of the vocal folds. So, during this foreign body removal, if we injure the internal laryngeal nerve, this can anesthetize the larynx above the level of the vocal folds, resulting in loss of cough reflex. And this further can lead to aspiration of foreign materials, resulting in fatal respiratory obstruction. This is why we must know the anatomy and the relations of pyriform fossa. So, if pyriform fossa is asked, that we must learn in the anatomy of pharynx is Killian's dehiscence. Killian's dehiscence is a potential area of weakness which is located between the fibers of thyropharyngeus and the cricopharyngeus. Thyropharyngeus and cricopharyngeus are parts of the inferior constrictor muscle. Normally, these muscles are coordinated, their actions are coordinated. Now, what do we mean by this? Whenever thyropharyngeus contracts, the cricopharyngeus will relax, allowing for the food to pass inside into the esophagus. And the vice versa is also true. In case of neuromuscular incoordination, both thyropharyngeus and cricopharyngeus will contract together, resulting in increased pressure within the pharynx, and this could lead to occurrence of mucus diverticulum which arise as the outpouchings. These outpouchings are called as diverticulums, and there are two important diverticulums that affect the region of cricopharynx. One is called as Zenker's diverticulum. The Zenker's diverticulum is a mucus diverticulum which arises from the lumen of the pharynx in between the fibers of thyropharyngeus and cricopharyngeus, or through the Killian's dehiscence. So, this diverticulum is called as the Zenker's diverticulum, and this is found more in posterior plane close to the midline. Then we have one more diverticulum which is called as Killian-Jamieson Diverticulum, which is comparatively rare condition. Here, the diverticulum is coming from the lower border of the cricopharyngeus. So, this is not exactly coming from the Killian's dehiscence, but from the lower border of cricopharyngeus, and this lies more in an anterior plane. So, the basic difference between the two and how to identify the two diverticulum, If a diverticulum is located in the anterolateral part of the neck or the pharynx and it is emerging from the lower border of cricopharynx, it is Killian-Jamieson Diverticulum. If a diverticulum is arising more so in the posterolateral plane of the neck and in the area between the cricopharynx and the thyropharyngeus, or from the upper border of cricopharyngeus, we call it as the Zenker Diverticulum. These three topics are very often asked as either 3-marker or 5-marker questions in your exams. So if asked, this is how you must describe each of these subtopics related to pharynx.